It's time for Access the Experts from the University of Nebraska at Omaha with your host, Brandon AKSAMIT.
Hello and welcome to another edition of Access the Experts on News Channel Nebraska, where every Tuesday and Thursday, University of Nebraska at Omaha faculty members answer today's questions facing our state. Today we have the pleasure of hearing from Dr. Susan Reay, who is an assistant professor at UNO's Grace Abbott School of Social Work. It's Suicide Awareness Week and September is Suicide Awareness Month, so we are putting an emphasis on mental health. So Dr. Reay, today's question is, what is therapy really like?
Thanks, Brandon. I would be happy to talk to you today about what is therapy really like. I want to start by saying that over 40 million adults in the United States are receiving some sort of mental health services, and the numbers continue to rise. It's probably because there are a lot more therapy options for people than there used to be, and people can access services in many different ways. So now we can have telehealth services, you can do in-person services, you can do drop-in sessions, you can even have therapy that comes to your home, and even texting therapy. So there are many ways for you to receive services to whichever best fits your needs. Therapy is really about a process of self-discovery. So where you are really the expert in you and your needs, and the therapist is the expert in helping you figure out ways to evaluate what your thoughts are, what your behaviors are, and what your feelings are, and seeing how they're all kind of connected together. So therapists don't tell you what to do. Therapists help you find ways to look at those things differently. For some people, it might be looking at ways of handling sadness that they're feeling or anxiety that they might have about school or about work or about relationships or other things that are in their life. And in other ways, it might be about looking at some things that have happened in the past with trauma or alcohol or drug abuse. Therapy is really about finding someone neutral that is licensed, that is an expert in their field, that is a professional, that is there to listen to you in a non-judgmental way. It can be talking about all kinds of things, maybe abuse that you've experienced in the past, or stress or anxiety, and whatever your basic life circumstances are. It's been noted that even in just a few short sessions, many people start feeling better after feeling bad for a really very long time and not thinking that that ever could feel better again. So therapy is really about hope, and it's about your own personal resilience, and it's about helping you as a tool to get your life back on track. It's about you doing what you need to do to take steps to take care of yourself after dealing with difficult feelings that you may have had for a very long time. It's about talking with somebody, it's about learning, it's about practicing new behaviors and skills. It's about kind of trying to find some ways of working out problems, finding those strengths within you that you already have, and bringing them back to the surface and bringing you back to life. UNO has lots of different resources for you here, and you can go to unomaha.edu and search for our counseling and psychology services, which is the CAPS program, where we provide lots of different resources, support groups, therapy sessions, and the recovery community for you to receive services.
Access the Experts, presented by the University of Nebraska at Omaha. If you have questions, submit them on our website. Then join us every Tuesday and Thursdays at 6:46 a.m. and p.m. while we answer your questions.